Welcome to this short video on how to access vital information held on SystmOne GP Units as a view-only function to ensure secondary care clinicians are aware of past medical history, allergies, current medications, chronic conditions such as asthma, diabetes or epilepsy, and safeguarding alerts. To start the process, you will need to log into SystmOne using your smart card. So click on with NHS smart card. You must only log into SystmOne with your own smart card. The consequences of someone else using your smart card are you will both be subject to disciplinary action, you will be held responsible for the record being accessed, and the patient record access audit trail will be incorrect. The unit that you will access is the Dewsbury Hospital A&E and MAU. So click on the Log On button. This will take you to the home screen for this unit. On some occasions, the information dialog box opens, and this is regarding using a username and password. Usual access to SystmOne unit is via your smart card. So we shall click OK, click the cross, and click the cross again. The home screen allows you access to many areas in SystmOne. However, you will only use the search function, the magnifying glass. You will also notice on the home screen the Help Guide button with the red question mark. This leads you to the Intranet help pages for SystmOne A&E View. So you can click on that once and it will launch the page. Once you've reviewed the information, this can be closed by clicking on the cross in the top right hand corner. Please be aware that you will only be able to view a patient's record if the patient's GP is using and recording information using SystmOne. Most of the GPs use SystmOne in our area. We will now begin to search for a patient. There are multiple ways to search for a patient in SystmOne. When searching for a patient's record, you must always, where possible, use the NHS number. This number is unique to the patient and should bring back only one search result. I will demonstrate this using a test patient. The first search functionality we will use, we will select the search button from the toolbar. The Quick Patient Search dialog box opens. I will now search for a test patient called a Mickey Mouse. I will type that information into the name search field. I will now click onto the search button. The Quick Patient Search only displays the first 100 patients that match your search criteria. However, you will want to narrow down your search, so using the NHS number is the best way to search for your patient. So I shall click OK and close the Quick Patient Search dialog box. I am now going to use Patient Locator, which is another way to search for patients, and I'm going to search for my test patient using that button. As I am using a test patient for this video tutorial only, I will place a tick into the Include Test Patients tick box. And now we'll search for Mickey Mouse, but this time using the NHS number. So I'll click it into the NHS number field and type in the NHS number. I will now click the search button. You can see the search results at the bottom half of the screen. As I have used the NHS number, it has only brought through one record. Notice that this patient is displayed in orange. This is because this is a test patient. To retrieve the patient record, double-click on their name. And this will retrieve the patient's record. In line with the new General Data Protection Regulation, GDPR, the patient will be informed that when they attend the trust, we will be accessing their health record to ensure they receive the best treatment possible. When accessing a patient's record, you may see the invalid NHS number box. If you see this message, you should not use this record as it is out of date and clinically unsafe to use. You will need to log a job with the help desk on extension 5000 for the SystmOne Digital Systems team as an invalid NHS number issue to investigate this and to help you get the correct NHS number for the patient. You may also see the Spine Patient Record Differences box if the patient has changed their address or telephone number. If you see this box, click on the Do Later button at the bottom. You are only viewing the record. The GP practice will update the patient record. In the patient record, the patient details will appear in the top right-hand corner of the screen. This is called the Patient Demographics box. You can hover your mouse over this box to view more information on the patient. In this box, you can also see picture icons. These are GP patient markers. These are usually displayed when a read code of a diagnosis has been entered into the patient record by a GP. For example, a diagnosis of diabetes. You can hover over these patient markers to display further information. Let's navigate the patient record further. The clinical tree down the left-hand side of the patient record contains nodes or folders with information about the patient. Let's take a look at some of those nodes that will be useful for you to view information about your patient. The patient home node. If the patient has any alerts recorded, you'll be taken straight to the patient home node. You must read these alerts as important messages may have been recorded. For example, under no circumstances divulge the address of the patient. Next, we have the A&E Quick Glance node. This node contains information such as sensitivities and allergies, summary, including long-term conditions, family history, repeat or current medication, prescriptions for the last 6 months, medication, how many issues and dates, vaccinations, common measurements, for example, height, weight, BP, and the latest readings, and the last 7 clinically relevant events. I'm going to go to the Major Active Problems node. If the A&E Quick Glance view is blank, you can click on the Major Active Problems node to view, for example, chronic diseases, for example, depression. We have the EPACS Summary node. So this is the Electronic Palliative Care Coordination System Summary node. Information is shown in this node when the EPACS template is completed, when a patient has a palliative diagnosis, for example, resuscitation status. The gold standards framework should go hand in hand with EPACS. The Golden Standards Framework identifies patients who potentially may be in their last year of life to help support patients to live well, establish what is important to them, and ultimately die well in a preferred place of care. We have the Safeguarding Information node. Our patient isn't on a safeguarding plan. This screenshot shows the different alerts in relation to a child's known vulnerability. Safeguarding information doesn't rely on sharing the patient record, so it doesn't matter if the patient has not consented to share the record. Some further information about the record. No pathology results are available from the patient record as there is no link to ICE. No records or part of the records can be printed due to confidentiality issues we have agreed with the CCGs. You will only access the record to view it. We're going to take a look at the Summary Care Record node. If a GP surgery does not use SystmOne, you can click on the Summary Care Record node. You will have to complete the Consent to Share box. If a patient has opted out of Summary Care Record, you will see text informing you of this. When you have finished viewing the patient record, you will click on the Discard button in the toolbar, the red bin, to close the record without saving. You're returned to the Patient Locator screen. To return to the home screen, you can click on the Home tool button. Or you can click on the F8 function key on your keyboard. Always remember to log out of SystmOne when you have finished. Remember, you will be liable for anything recorded into the patient's record under your sign-on details. When exiting out of SystmOne, always make sure the patient demographic box is empty, so that means that a patient record isn't open to you. And the best way to log out of the system is to click on the F11 function key on your keyboard. And this will take you straight out of SystmOne. Thank you for watching this short tutorial video. This e-learning video was produced by the digital training team at Mid Yorkshire Hospitals NHS Trust. Please see our SystmOne intranet pages for supporting materials.